Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And today I'm so pleased. Vicki, it's great to have you here. Vicki Blacker-Barthel, wonderful to have you here today.
Thank you.
Now, we have a lot to talk about, and you have an incredible role here at Albany Med that's very special. And the work you do on campus and off campus is something that I think is very inspirational, and we're going to share that with our workforce. But let's start at the beginning. First of all, how long have you been at Albany Med?
I'm starting my 15th year.
15th year.
Yep.
And your current role here today is?
As the breast health navigator, although I work as well in vascular radiology, interventional, so I have two passions.
And for those people who are not as familiar with those terms, let's break those apart a little bit. Vascular interventional radiology is a specialty within radiology with physicians and then with nurses and technologists who work on patients, and they can do very specialized diagnostic procedures, and they can also render treatment for people in a specific suite. We call that the angio suite. And as an emergency physician, I know there are many patients who would come into the emergency department who might need treatment for a stroke or might have some bleeding occurring internally, and we would send them down there. So it provides incredible diagnostic procedures, and it provides life-saving procedures as well. But then you also mentioned some of the work that you're doing with breast health, and that is over on Hackett Boulevard, correct?
Correct.
So let's talk about that specifically. Tell me what your role is over there. You use the word navigator. What do you mean when you say that?
So I streamline the patient. I'm their first contact there. And should someone be coming and not expect a problem, they meet me in the beginning so that they know that there's a person that can help them with making appointments, with making certain that the results go where they need to go. And then for the woman who is involved right now with a problem, I have the opportunity to handhold, if you will, to make certain that we have everything that we need so that we can make a diagnosis. Should they have a diagnosis that is malignant, those patients are walked over to our breast surgery center, which we work very closely with Doctors Choi and Abraham with our patients. And I think that was Albany Med's goal, was to have a comprehensive women's center.
That was the goal. That was the goal. Let's talk about that population. We're talking about women who present. There may be some concern about breast cancer. Sometimes that diagnosis is confirmed. That has to be overwhelming to that individual to have that information. You're, as you say often, the very first person who's there when that diagnosis is made and helps them through that process. So talk about that. Talk about that role you play as far as connecting the dots with where they need to go from there. And then walk me through that journey with that patient.
Sure. So the patient a lot of times is just so frightened, and they just need somebody to break everything down for them, which is a part of my responsibility. I get them scheduled for a biopsy. I make certain that they understand what the biopsy, what their expectations should be. And if they feel as though, geez, I've been waiting for my path results and it's been 3 days and I'm nervous, I tell them, this is my job. You call me. I will advocate for you. And then I make certain if someone is facing breast cancer, they've gotten the diagnosis, I make sure that I have such a relationship with the surgeons, which I'm so proud of, that they get them in quickly so that the anxiety goes down. And as a team, and I truly use the word team because we all work together for the greater good for this patient.
Well, it's not lost on me you're wearing pink today. I think that's an obvious signal to the population that you serve and the people that you work with in that very special area. You mentioned the two very skilled surgeons that we have here that we're blessed to have. It really does take a whole comprehensive team, right? Talk about some of the other members of the team that you work with.
Sure. So we are led by a magnificent medical director. Her name is Dr. Sarah Raymond.
Absolutely.
And Sarah works very collaboratively. Her and I work side by side.
Radiologist.
She's my radiologist, yes. And she, protocols the cases. I get them all ready for her. So we are able to be a team approach to this patient, and she's always accessible. The breast center is led by Jennifer Dwyer, who supports the center completely. She also does mammograms as well, and she makes certain, her goal is patient satisfaction, the same as mine. We have so many talented mammographers and sonographers and our staff with scheduling. We have a great team, and the leaders, I believe, are part of why we're successful.
Yeah, well, and they're also successful because of someone like yourself I know that you're not interested in necessarily talking about yourself in this way, but I'm going to make you do that. You recently received an award for the work that you do in this area. Is that correct? And talk about the organization that recognized you.
Yes, so 2Life has an award that they give every year, and it's called the Extra Mile Award. And it's funny because I always said if I ever got that award that I would retire, like I would have made my my career goal. However, my journey's not over, and I was so honored, and I was able to have my son come from Florida and my other son who lives here to celebrate with me because I'm able to do this community work and be out there and walk the patients through, and years later they contact and say, look, I'm doing okay.
I was going to ask you that. So do you stay in contact with the patients who you've helped through that journey? And the answer is yes.
Yeah, I do, and it's wonderful. You know, I keep in touch. They send me pictures of their grandchildren. It's great.
One of the things that we talk about in these videos a lot is the mission that we have here and how healthcare is such a unique and special and important mission, and the work that you do truly changes lives. I suspect that's one of the reasons why you stay here. What are the other reasons why you stay and work here at Albany Med? So thankfully you didn't retire after you got your well-deserved award. So what are the other reasons that you decide to stay and work?
Well, because I really credit that Albany Med takes it very seriously, that technology is improving every year. We have the state-of-the-art equipment. We just started doing localization seeds, which is very beneficial to the patient as well as the surgeons. And we've already done 50 of them since July, and the outcomes have been spectacular. So that's all a feather in your cap to work for an organization that's willing to invest in us.
That's excellent. Now let's dive a little bit deeper. So beyond that work that you do in the clinic, there's also a couple areas that you do that are very important for this as well. So talk about the support group that you lead.
I lead a support group which currently is being housed at the American Cancer Society in Latham. I meet once a month, and these patients that attend are typically, not always, but Albany Med patients, and they're from the beginning of their journey up until survivorship, so everyone is welcome. And it's a really great opportunity to meet with the patients and help them through this difficult journey.
How many would be in a typical group when you would meet?
There's about 10 women that come. Sometimes they bring their significant others, they bring their children, they bring, you know, and that's what support is all about, involving your family. Yeah,
that's very special work. And other special work you do is you sit on the cancer committee here at Albany Med, and that's a group led by Dr. Bellomo, who's a wonderful oncologist. Cancer committees are really important. They're required by the American Cancer Society and our accreditation, but they also do really important work as far as prioritizing what we do, the resources we need. So talk about that role and the advocacy you bring to that committee.
Yes, so Dr. Bellomo, one of the biggest things that we wanted to have was to have a survivorship program. And Dr. Bellomo loves the garden, and since that's my heart is in that garden, that is really where the survivorship comes in, is because we are giving back to and involving the people. There is things after cancer.
That's right.
And they know it.
That's beautifully said. Now, you also had to do some work in a garden, and I think this is an incredible story. When you were telling me this, I thought we have to talk about this. So talk about this garden. This is fantastic.
Well, so it's called the Pink Ribbon Garden, and it's out in Altamont, and it is actually planted and harvested by breast cancer survivors. And the mission of this is that the breast cancer survivors work in it. My patients that receive the vegetables will then in turn volunteer, and then it's full circle. And the beauty is that we have, just in the 3 months, we have served 159 women, women that are underserved, women that are going through chemotherapy and perhaps they can't get out to the grocery store. They're getting fresh vegetables, and there's proof that fresh homegrown vegetables are very good for healing.
It is incredible to me. Every day I learn something that we do, that our workforce does, that I had no idea about. So there's this garden, and the breast cancer survivors plant it, and they harvest it, and they grow it, and then we bring those, or you bring those vegetables to patients who are undergoing treatment.
Yes.
And then when they are done with their treatment, they can't wait to get there and work in that garden and pay it forward.
Exactly.
It's amazing. And tell me the name of it again.
It's called the Pink Ribbon Garden, and the organization is Libby's Legacy.
Sure.
And it's just, especially our population, our patients are so grateful for it. They really are. And actually Broadview has now joined in,
Right.
and they're giving us vegetables from their garden, so I'm getting
Right.
a double batch.
That's wonderful.
So I love it.
We do know that Broadview also likes their community gardens, and it's
Mm-hmm.
very impressive what they do there as well. So that's fantastic. Has it been a good growing season, by the way? Has it been?
It started out slow, but I've got plenty of tomatoes.
Tomatoes.
And I distributed 10 bags to Dr. Abraham this morning, so.
Oh, that's wonderful.
Yeah.
And there are other things you like to do outside work. So you're a fan, first of all, of music, right?
Mm-hmm.
You love, and you're not the first person who sat here who talked about their enjoyment of music. All genres or any particular type?
Yeah, but I do like rock music, so
Okay.
I do go
So do
to
you go
concerts. And
up to SPAC a lot?
I go to SPAC, I go to some of the local stuff that they have here.
Right.
I went out to Las Vegas.
Did you really?
To see Foreigner. I know.
Were they at the Sphere or where were
No,
they?
they were at the Hard Rock.
Oh, that's
So,
fantastic.
yeah.
So you go to small venues, you go to large venues, you travel, you love live music. And it is wonderful to have SPAC in our backyard because a lot of bands come through there, and I'm sure you get a chance to go there as well.
I do.
You know, people. I can't tell you how many people I've met who claim they were at the University at Albany when U2 was there 40 years ago, before they became popular. Were you one of the people who were there that day?
No, I wasn't.
I think half of them lie anyways. I don't think most of them were there. But we do know that a lot of bands come through before they're very popular. And I'm sure you saw some on their way up
Yes.
before they became popular.
Absolutely, and
That's
it's fun. It's
Right.
just, and it's a, you know, it's just, it's a great opportunity to get out in the community.
And you like to exercise. And there's a particular type of exercise that you do.
Yeah, I do bar classes, which I love. It's low impact, it's very disciplined, and lets me allow to kind of go in a little zen after a day.
Yeah, that's important. Now, I'm not as familiar. Is that an offshoot of like ballet or
Yes.
based off of ballet? Did you do ballet when you were
I did.
younger?
I did.
Okay.
Yep.
Okay. So so you're on the BARRE bar. That's a big crossword puzzle word, by the way. And it helps you stay connected, and like you said, it's helpful for you for your mind as well as
Yeah.
physical.
Yeah,
That's wonderful.
absolutely.
That's wonderful.
Yeah.
So what's the future look for you here? Staying here, working here, committed to the mission. These are the things that still keep you going here every single day.
Absolutely, because even in the breast center, we have such important ties
Right.
with the interventional radiology. Our patients may need
Right.
a biopsy that we can't perform, and IR helps us.
Right.
We get our patients with ports and quick, with IR. So, I mean, imaging is a very interesting
is.
entity, and we all complement one another in the work we do.
Wow.
So I see myself retiring from Albany Med, but not in a while.
That's-
For a while.
That's the best thing I heard in the whole interview. We often talk about 920 jobs at Albany Med, right? The goal
Yeah.
here is hopefully someday I can interview somebody from all 920, but yours is a perfect example of the importance of that role in our mission and taking care of the community in such an impactful way. And I love the way you described all your teammates and the sort of sense of family over there and how everyone is working together on really an important mission. And I love the work that you do in the community with the garden. And
thank you.
I really appreciate that you took the time to help us understand what happens over there and the role that they play in the delivery for breast health at Albany. So thank you very much.
You're welcome. You're welcome.